Diabetes is the cause of death for over 70,000 Americans each year. Diabetes also has a long list of complications resulting from this disease. Dr. Nilem Patel of Pomona Valley Hospital Medical Center explains the causes and treatments for diabetes.
Diabetes is basically saying that your blood sugars are elevated and you don't have that counterbalance in your body to bring those blood sugars at a regular level. And so for me, I would say that is what I tell patients to make it easy, that it's like eating a candy bar, your blood sugar goes up, but you can't counteract that candy bar and bring your blood sugar back down to a normal level. Due to that, it can lead to several kinds of complications. Left alone, diabetes can affect the eyes. Many people have heard of patients with diabetes having blindness. It can affect the kidneys and lead to dialysis in extreme cases. It can affect your nerves, and which leads to you stumping your toe, not feeling feeling that you cut it. You get an ulcer. Next thing you know, your foot is gone. So very dramatic complications, but they're very valid, and it's something that needs to be taken care of earlier on. It can also lead to cardiovascular disease, which basically means you can have a heart attack. Oftentimes, I think we don't have any symptoms, and that's why it is left not taken care of. So early on, you can have symptoms of increased thirst, feeling that you drink a lot of water throughout the day, which you normally didn't once upon a time. Increased urination, going to the bathroom often, and oftentimes waking up in the middle of the night to use the restroom, which you normally would not have done in the past. Extreme fatigue, depression, and blurry vision at times. The majority of the diabetics are type 2, which makes up about 95% of the population. Type 2 diabetes usually occurs in older individuals, though recently we're seeing it in younger individuals due to the predominance of obesity in the United States. There's certain races that have an increased risk. For example, Indian, American Indian, Hispanic. So these populations, they do have higher risk of diabetes. Also, I think our awareness of checking for diabetes is there. So in the past, we may not have as good modalities as we do now for checking for diabetes. So we're diagnosing it more, we're diagnosing it earlier. You can prevent diabetes by living a healthy lifestyle, which means diet and exercise. A lot of times we tend to supersize our meals, eat more than what is necessary, and portion control does play a major role in prevention of diabetes, as well as maintaining your diabetes at a good level. Exercise is very important. Normally I usually tell my patients that I will be ecstatic if you do 7 days, 30 minutes each day. I would be very happy if you do 5 days a week, 30 minutes. Partially happy 3 days a week, 30 minutes, and probably not so happy if you don't do it at all. So the importance of exercise is there. It will improve your blood sugars, and definitely it does help with the weight.
Dr. Patel explains certain diet guidelines for a diabetic.
A diabetic should enjoy their life and eat what they like to eat, but it's the portions, it's the carbohydrate control, it's the management, and it's also the exercise that they put in. So normally what a diabetic patient, or even a pre-diabetic patient, or even a patient who is trying to avoid diabetes should do is to maintain what we call a consistent carb diet, which means that you can eat a certain amount of carbohydrates throughout the day, but have them spread out and have only a certain amount, when you call of grams of carbs per meal. So normally we want to say about 45 to 60 grams of carbs for females and about 60 to 75 grams of carbs for males per a meal. Oftentimes if you go out to eat, you end up eating 100 to 150 grams of carbs at that meal, which is too high of a carb load.